We're talking about a grave change. We went through strikes and there was barely any movement with that.
In the midst of an ongoing healthcare crisis in Quebec, the province is trying to bring back nurses from the private sector into the public one. Some nurses say they won't do it until major changes are made.
We need to cut the red tape. We need to cut the bureaucracy, and we need collaboration from our government. We need to sit down and have a conversation, find ways to get better recruitment of nurses, find ways to pay nurses better.
The province reached an agreement with the CSN union to allow nurses to maintain some seniority, meaning that if private sector nurses come back to work in the public sector, they can start their new job with up to 5 years of seniority.
What does that really mean, though? Like, I'm just in line for a vacation. Is that it? I have a greater number of days for vacation. It doesn't really mean much, you know, and they're dangling this as if nurses are going to come back from the private sector. But right now, with regards to work-life balance, with regards to pay, and with regards to flexibility, the private sector is much more in demand right now than the public sector.
Naveed Hussain, who's been a nurse at MUHC for 20 years, made the transition to the private sector 5 months ago.
We're valued as nurses, whereas in the public sector, we're just a number. So that's a big reason why I made the jump and why I'm decreasing my hours at the hospital and increasing my hours in the private sector.
Both Hussain and Melanie Bouleris, CEO of Nomadic Nurse Agency, say the private sector has more opportunities for growth.
We've noticed that in private, we have different avenues of nursing that we can pursue, and the pay does considerably be more interesting.
Last year, Quebec Health Minister Christian Dubé introduced Bill 10, which aims to eliminate the use of private agencies in the health network by 2026, stating that if workers continue to leave at the same rate, they'll need to recruit over 100,000 new staff in the next 5 years. Bouleris says in order to get nurses into the public system, improvements need to be made.
We're talking about working conditions. We're also talking about salary. We're also talking about patient safety and just abiding by the OIQ standards of nursing care. And we're unable to provide that. So seniority is, unfortunately, it's the least of our priorities, at least of mine.
In Montreal, Swidda Rassy, City News.